It's time for our monthly segment, KEZI 9 checks in. It's a reminder on the 9th of the month for women to do a self-breast exam to check for any lumps or changes. And this month, we're also focusing on genetic testing during pregnancy. Here's KEZI 9 News anchor Renee McCullough. Renee.
Well, joining me now is Dr. Charlotte Clausen with Women's Care, and today we're going to talk about prenatal genetic testing. And the first question is, when should women get tested?
Most women opt for testing in the first trimester of pregnancy, but the nice thing about our tests that we have now, there are options throughout the whole pregnancy.
Okay, so what are the different kinds of testing that you have? Yeah,
so there's two different types of testing. So there's screening testing, which is the most common, and then there's invasive testing, and I'll kind of talk through each of those. The most common thing that we do is screening for two different types of things. So first is for the risk for spontaneous chromosomal problems, and the second is the risk for the chance that a mom could be a carrier for an autosomal recessive condition or something that they could pass on through their family.
It can be so nerve-wracking for new moms or moms-to-be. So what are some of the benefits of genetic testing?
Yeah, so a lot of our moms are advanced maternal age, and that's the most common reason that we offer screening, but we do offer it in all pregnancies. So those moms come in with a little bit higher risk for spontaneous chromosomal problems, and the nice thing about the screening test we have is it can give reassurance that their screen is negative and thus they're low risk now.
Right, you help with some of that stress during pregnancy,
exactly.
Right? So are there any risks for the mom or the baby with this testing?
Yeah, so for screening tests, the only risk we have really is the risk of a false positive result. So it's really important to do pre-test education about what does this result mean? If it comes back positive, does it mean my baby has a problem? Which it doesn't. And so just letting moms know that positive screening test doesn't mean the baby has a condition, but we could offer other diagnostic testing to check further.
To double check.
Yeah.
So how accurate are they then?
Yeah, so there's two types of testing. There's hormonal screening testing, so called a sequential screen, and then there's fetal DNA testing. And so the sequential screen, which is what we usually start with for low risk moms, the detection rate for chromosomal problems is about 93%.
Okay.
With fetal DNA testing, that detection rate is about 99%. So they're really getting more and more accurate
as the time goes on.
As time goes on. Yeah.
What about these new at-home kits where you can find out the gender of the baby? Are they safe? Are they reliable?
Yeah, so they're simple tests and they're looking at the baby's DNA. It's interesting, it's just a simple pinprick. So the accuracy they report is about 98% on calling the gender. However, the limitation is only about 80% of people actually get a result because it's a smaller sample.
Okay.
And then the other interesting thing is that you have to kind of decontaminate the areas. There's no Y chromosome that could get confused with the blood sample because it's looking for the Y chromosome.
Sure. Okay, so they are fairly accurate.
Fairly accurate, yeah. If that's, it's kind of a novelty test, and it's important to understand what you're actually testing for. It's just looking at the if that Y chromosome is present.
Got it. All right. Thank you so much for joining us today. And for more information, you can go to our website at KEZI.com.
Be sure to go to our website also to sign up for KEZI 9 checks in, and we're going to send you a reminder each month to do your monthly self-breast exam.